Welcome to Buta News.
Okay, today we want to discuss about health session. Today we want to talk about health session. We have two main topics for health session. That is depression and breathing.
So, what is depression? Depression is a common and serious medical illness that negatively affects how you feel, the way you think, and how you act. Fortunately, it is also treatable. Depression causes feelings of sadness or a loss of interest in activities once enjoying. It can lead to a variety of emotional and physical problems, and can decrease a person's ability to function at work and at home.
Okay. People who have depression, it is that we cannot identify if he or she have depression or not because he suffer inside, not the outside. But we can identify ourselves if we have depression or not by the symptom. There were a few symptoms such as feeling sad or having a depressed mood, loss of interest or pleasure in activities once enjoyed, change appetite, weight loss or gain unrelated to diet, trouble sleeping or sleeping too much, loss of energy or increased fatigue, increase in purposeless physical activity, feeling worthless or guilty, difficulty thinking, concentrating or making decisions.
Mary and I will talk about factors of depression. So about 30% of there are many factors that can influence the feelings of depression, such as who does have depression and who doesn't. So the causes of this depression are often tied to our health because most most people they will have medical condition, and when they take certain drugs and medication, they will put you into higher risk such as chronic illness, insomnia, chronic pain, or ADHD, which is attention deficit hyperactivity disorder. There are also drug use because sometimes people who experience stressful events such as death of a loved one, economic problems, or divorce, they will feel stressed and they will become depressed because they do not know how to get help and express themselves to other people. So they will tend to use drug to make sure that they do not feel stressed. So a history of drug and alcohol misuse can give more impact to your risk of depression.
Okay, I will explain about depression. What causes depression? While we don't know exactly what causes depression, a number of things are often linked to its development. Depression usually results from a combination of recent event and other longer-term or personal factor. Um, personal, uh, personal factor such as family history, personality, serious medical illness, drug and alcohol use. Family history depression can run in families, and some people will be at an increased genetic risk. However, having a parent or close relative with depression doesn't mean you all automatically have the same experience. Life circumstance and other personal factors are still likely to have an important influence. Personality, some people may be more at risk of depression because of their personality, particularly if they have a tendency to worry a lot, have low self-esteem, a perfectionist, or sensitive to personal criticism or self-critical and negative. Okay, as serious medical illness, the stress and worry of coping with a serious illness can lead to depression, especially if you are dealing with long-term management and or chronic pain. Drug and alcohol use. Drug and alcohol use can both lead to and result from depression. Many people with depression also have drug and alcohol problem. Over 500,000 Australians will experience this depression and substance use disorder at the same time at some point in their life. Okay, I will pass to yeah.
So, of course, the depression for someone that have this symptom, they can affect their body, especially if left unchecked. The first effect is feeling of sadness or apathy. They will feel lasting sadness, empathy, and hopeless, or they feel guilty when do some things, and will affect day to day in their daily life because they keep remember what they have done. And the second one is trouble with memory or decision. They this will affect their memory, and it will affect their memory, and they will do not know how to interpret whether the situation or decision is true or false. Lastly, and the third is insomnia. They keep uh, awake at night and do not sleep for entire day, and uh, always remember what they have done in daily life.
Okay, I will explain more the effect of depression. Okay, firstly is depression can cause can constricted blood vessel. Okay, when it constricted the blood vessel, can cause the risk of cardiovascular diseases. Okay, other than that, depression also can risk of heart attacks. We can see nowadays the people who is manage the organization or the business, when the business is fall down, they feel depression, so they can easy to get the heart attack. Okay. Other than that, weight fluctuations. Okay, depressions can lead to overreacting or appetite loss. Using food to cope can lead to obesity-related illness and stomach ache, while poor eating may result in nutritional deficiencies. So, people who is depressed is more likely to eat, and it can cause obesity. Okay, the lastly is depression among the students. When they are depressed, such as when they have been bullied, they make them feel to go to the school and do their activities. Okay, so that's it. So, okay, I will explain more about the effect of the depression. Okay, the firstly is it can constrict blood vessel. Okay, depression and stress can cause blood vessel to contract, constrict. So it can raising the risk of cardiovascular diseases. Okay, other than that, it can risk of the heart attack to the people. As we can see nowadays, the people which manage the business, the organizations uh, can easily get depressed. This is because when they example, the example is when their business is go down and not went well, they can go easily depressed. Okay, the lastly is the people who is depression is more likely to eat more, so this can cause them to obesity. Okay.
Okay, next,
Isma and me will talk about how to prevent depression. So firstly, how to prevent depression is by doing exercise. Because if you are doing exercise, you actually produce a chemical reaction which is known as endocrine. That's very good for our body and will make us feel more happy. That which can prevent us from feeling depression. Second is if you feel depressed, maybe one of the way to decrease your depression is by talking your problems with someone who you're talking your problems to someone you trust, like your parents maybe, or maybe your best friend. So by doing so, you will feel very better.
Yeah, thirdly, we must to avoid stress. A variety of factors, including works, education, family life, or relationship, can cause stress. It is important to try managing and addressing this stressful situation when they arise. If you have any problem, you must find any help or try to talk to other person. And lastly, get enough sleep. Not getting enough sleep can have a significant impact on people physiologically and physically, and it also cause insomnia, which is associated with depression. If you have insomnia, there are several ways to cure it. First, you can creating a bedtime routine. Secondly, avoiding using electronic equipment before sleep, and lastly, spending 30 minutes before sleep reading books or try to relax. And this is all for our this precious topic. Now we will go on to our next topic.
So now we will talk about vaping. Vaping, yeah. So what is vaping? Vaping is the action or practice of inhaling and exhaling the vapor produced by an electrical cigarette or similar device.
Vaping is an alternative to avoid smoking cigarette, but actually it's not. Vaping is very popular nowadays because the small size and easy to take everywhere. Vaping is come in many flavors such as strawberry, grape or others, and vaping produce usually contain uh, uh, usually contain propylene glycol or vegetable glycerin based liquid with nicotine. Uh, that's all. Next we to
So, Nurul and I will talk about the factors of vaping. As we know, vaping is a new, harm-free, and less addictive than traditional combustible cigarettes because um, mostly they think that with the advancements of human, they think we have created a more safer way to smoke because and there are also people who have never smoked cigarettes. They are influenced by other people to use vape, so that because they thought that vape are less harmful than cigarettes. So one of the factors that um, they influence people to use vape because mostly they are people around them, or such as family members or their own friends, they use vape during their lives. And more importantly, uh, we are influenced because in the new study published in the Journal of Youth and Adolescence by Lippert and his co-authors, they examined data from 65,000 middle schoolers and high schoolers, and they to learn how much per influence can do to to students, and they found out that peer influence, their students are exposed to new popular things. They are influenced by how their friends, uh, uh, by their friends, such as they are influenced by vaping because they thought that their students they teach one another about vaping and why it should be considered unsafe, and they thought that e-cigarettes or vaping are safe and not the cause for lungs. However, recent research shows that nicotine exposure can harm brain development, which continues until age 25. It makes it harmful, especially for students to smoke, whether it's cigarettes or vape.
Okay, I will explain the reason why most students use vape. The most common reason were firstly because a friend or family member. Secondly, the flavor of vape such as mint, candy, fruit or chocolate. Thirdly, believe that vape are less harmful than cigarette. Lastly, vape costs less than cigarette. That's all.
So, if uh, better, if someone is vaping, they will has a effect to the body, such as mouth and also brain. For mouth, some user report that cutter mouth has cutter mouth, scratchy throat and coughing because of the airways of the because the airways is uh, become thin and hard to breathe. For the brain, the dopamine level has increased as nicotine from the e-cigarette enters their brains.
Okay, other than that, the other part of the body that the bigger effect is heart. Okay, vaping with nicotine can raise heart rate and blood pressure. And the second part of the body that vaping can affect is lungs. Nanoparticles from vaping might be embedded in the lungs, causing inflammation and rising infection rates. That's all.
So, how we want to prevent someone from keep vaping? Firstly, you must good in choosing your friends because friends is a big influence in our life. So, if you're really good in choose the friend that not vaping, so you will also not vape. Second one, parents also play a big role in educate their children because parents are the person who are very close to them. So parents also should know the parenting skill, which is they should educate themselves. They should educate their children, which is good for their health, which is bad for their health.
Next, government also play an important role in prevent the teenagers or the citizen from taking from vaping. As they have power, they can introduce new law to the citizen. Maybe they can limit the age for the citizen to vaping, or maybe they can ban the selling of vaping to other people. And lastly, school. School also play an important role in educate the student the effect of taking vaping and what and maybe they can have a motivation camp uh, to help the student to increase their knowledgeable about vaping or other things that they cannot do. So this so we already looked all our topic today. So we will conclude we will end our discussion this. That's all.